all of you, I think you are from second year or final year students, and I would like to just know how many you have given a modality anytime by yourself. Please raise your hands. Only my candidates have done that. The main issue is, why should I be well versed with physical modalities? Why? I am a physiatrist. That is a job of a physiotherapist. Why should I focus on whatever they are doing, and I should be able to just narrate them कि ये you have to do this and the thing will be done. Most important thing, whenever you go in a private setup or a setup where you are the only one who is going to run the department, you find your attendants, receptionist, or other workers which are not physiotherapists. They have to be trained. Basic equipments of these physical modalities are very cheap. In a small setup, you can always have them, and to get this impact, you see, in financial year 23-24, we have seen 40,000 patients. Out of them, we have given 11,000 therapy sessions and only 3,000 interventions. In 22-23, there are 33,000 patients, only 2,980 interventions. This gives you a span of time where you can easily assess the transdisciplinary approach of a physiatrist. How a physiatrist works? He works in a transdisciplinary manner. मतलब, if you are well versed with हिंदी, मुझे भी तेरा काम आता है और तेरे को भी मेरा काम आता है. मतलब अगर तू छुट्टी मारेगा तो मैं काम कर सकता हूँ, और मैं छुट्टी मारूंगा तो तू मेरा काम कर लेना. तो with this approach, you are very well versed with their method of doing work and how the machines are going on. So how you are going to approach? You do a complete neurophysiological assessment. You do you find out the significant functional impairment in day-to-day life related to their occupation. Once I was young and around say 25-30 years, I have no back pains. My weight was controlled. Now what happens? I was a good player of cricket. Now whenever comes कि कोई गेम खेलेगा, फैकल्टी मैच होने वाला है, तो यार कमर दर्द करेगी अगले दिन. तो these functional impairments gradually seeps in your lifestyle. Those have to be entertained by a physiatrist. And every time you cannot run behind a patient with a needle. So you have to encourage gradual increase in flexibility of the muscles, strength of the muscles, and coordination of those muscles. Sometimes the joints are very much hardened up or say degraded. In those cases, you need to strengthen the muscles without moving the joint. These modalities can help you out in that venture. Minimum rehab program while managing a pain case is around say 12 weeks. You focus on reducing the pain first. Second, you go for flexibility. Then you train the person with strength. Then you allow them to coordinate. And then there will be higher conditioning if he is a sports person or something. मतलब reconditioning or strengthening for that particular aspect is necessary. There is a difference between last Dr. Pandey told multidisciplinary approach and transdisciplinary approach. Our new PMR book has given clear-cut indication what is transdisciplinary and what is multidisciplinary. So I think you should read that also. What are physical modalities? Physical, the word itself narrates bhautik, dehik, sharirik, all are physical. And modalities, it is a way of doing something. So any therapeutic medium that uses the transmission of energy to or through the patient for relief, that is a physical modality. You can use cold, heat, sound, electromagnetic waves, electricity, mechanical forces to produce desirable therapeutic effects. And these are commonly used to relieve pain relief or modulation, reduce inflammation, improve circulation, tissue remodeling, reduction and elimination of edema. Any joint which is sold up, if some modality is going to help him, that is like say we can use lymphopress. I have not mentioned in my detailed description due to shortage of time I got. So we are going to classify physical modalities in 3 broad categories: cryotherapy, diathermy, and electrotherapy. In cryotherapy, you use ice massage, ice packs, cold spray, contrast bath. In diathermy, these are further divided in two categories, which are going to help you in superficial heating modalities, and the other ones are deep heating modalities. The third one is electrotherapy. Here you use electricity in form of transcutaneous electrical nerve stimulation, iontophoresis, microcurrents. So with this, I am going to just lay out the basic foundations of how the particular principle works. With that, you can easily collaborate whatever the machine is. If it works in cold or say heat or say electricity, you can easily commonly write it out. Most of the time in paper 2, you have a question from this section. Either a short wave diathermy will be there, a principle of ultrasonic therapy is there, or somebody write out TENS or interferential therapy. And with that, if you make this ray diagram, it will be much easy for you to understand. And at the same time, reproduce at the time of exam. You will also have a table viva for physical modalities. Most of the examiners which come to our place, they ask our students to lift the machine, how it is, how you are going to use it. So you should definitely go and lift it up. So when you apply a cold, what happens? There is activation of cold receptors, descending pain control mechanism, release enkephalins, and there is closing of spinal gate. And at the same time, decreased tissue temperature leads to decreased cell metabolism. There is an increased viscosity, there is decreased need of oxygen, reduced cellular output is there, that will reduce the inflammation. So by decreasing the secondary injury, we reduce the scope of further trauma, and we reduce the pain perception and reduce the spasm also. Now we talk about the heat, how heating modality is going to transfer the heat. If we touch the two objects, it will be called conduction. If the transfer of heat by movement of a medium, usually air or water, it is convection. If energy is given in the wave form and it is transferring the energy without touching the tissue, then it will be called radiation. And if one form of energy goes in the body and converts in another form, that is conversion. Again, like cold, heat is also being used. As I go further, I will elaborate the different use and perspective. Then you will be much easy to interpret it. Heat application will again, this descending pain control mechanism will be releasing enkephalins and closing the spinal gate. We mostly use cold in early phases. We all know about the Price principle: positioning, rest, ice, compression, elevation. And heat is mostly used once the acute phase has subsided, the patient goes in subacute or chronic phases. So with that perspective, here we need to increase the oxygen demand, we have to improve the enzymatic activity, we have to increase the blood flow so that the pain producing substance should wash out from that area. So, and again, chronic deconditioning of that particular part, you need to mobilize the muscle by increasing the temperature and increasing the flexibility. So with this background, we come to electrotherapy. We all know about the gate control theory. जो शनिदेव होते हैं उनको पहले आपको सेटल करना होता है. तो ज़्यादा इम्पॉर्टेंट क्या है? स्किन सेंसेशंस. तो पेन perceptions are being carried over with A delta and C fibers, and A beta fibers supersede them. With this mechanism, we usually don't allow the sensory cortex to perceive the pain. And this is the opening and closing mechanism of the gate control. This was given by Meljak and Wall in way earlier, and we are using physical pain sensations. Nociceptive sensations can be hold up, but physical जो issues होंगे वो इससे settle नहीं होंगे. In substantia gelatinosa, these two fibers are there and they cross linked to each other. Here are the few cold modalities. These are the various pictures. You spray this coolant and then stretch the particular part. That will break the adhesions, and myofascial release is also done with that. General consideration when you are giving a cold modality, You have to think that if it is a deep kind of situation, cold modalities will be not that effective. If you are going for a local area, you can reduce the temperature to 0 to 10 degree. If a larger whirlpool type of equipment is being used, you can have a temperature 10 to 15 degree. If the whole body cryotherapy has to be given, the temperature has to be maintained from 18 to 26 degree. Minimum 15 minutes of therapy is needed, but if somebody feels burning sensation or something, then you have to immediately lift the ice pack, and or the whatever the therapy you are continuing, you have to stop there, then wait for 2 minutes, then again restart. The total duration will be 15 minutes. These are the various indications. As I said, price is the principle. Acute injury, inflammation, acute chronic post-surgical pains, prevent edema formation prior to or in conjunction with rehabilitation exercises, spasticity accompanying central nervous system disorders, acute or chronic muscle spasm and neuralgia. Contraindications, again related to vascularity, deep vein thrombosis, circulatory insufficiencies, lack of sensation in terms of anesthetic skin, advanced diabetic, which again leads to neuropathies, chronic wounds. Any open area, we try to avoid both types of heat or cold. Peripheral vascular diseases, Raynaud's phenomena is there. If any kind of blood dyscrasia is there, we have to avoid it. Precautions, carotid, we should not give it on the carotid sinus, over areas of infection near eyes. Avoid treating large areas with individuals having cardiac involvement. Somebody you dip with a cardiac pacemaker at 18 to 26 degree in cold bath, so that is not right. Now we are talking about the heat modalities. As we have said, there are two categories. One is superficial one, heating pads, hydrocollator packs, paraffin bath, hot whirlpool, infrared. And in deep heating modalities, you have to use shortwave diathermy, ultrasonic therapy, phonophoresis and microwave diathermy. Superficial heat, we are not poikilothermic, we are maintaining our temperature. So whatever the heat you are giving, that is not going to go deep. Superficial layers will be dissipating it. So whatever the things you are going with, say, conduction method, those are for the superficial planes. Deep heating modalities usually use conversion, which goes deep inside and deliver the heat by polarizing or depolarizing the ions in that particular area. These are the few diagrams. You should be well versed. Once upon a time, I gave my DNB exams in AIMS, New Delhi, and Dr. Yu Singh was there, and he asked me, this is a paraffin wax bath tub. What else what else purpose you can solve with it if you have a paraffin wax bath in your department? Luckily, from my Guruji, we came to know that it can be used as a heating pan. So this is a very important thing to remember. जुगाड़ आना जरूरी है जब भी आप rehabilitation करेंगे. This is the machine. I have given the details. कैसे चालू करनी है, कैसे बंद करनी है. यह सामने रखी होती है, हमारा कैंडिडेट खड़ा होता है और एक्सपर्ट पूछता है एंड वी आर ब्लैंक. फिर हमको लगता है यार ये चीज़ तो मैं भूल ही गया. This is been continuously preached by me since last 3-4 years. We are having 3-4 batch passed out, and every time we teach them, and every time they do this blunder. Last session, one person told the ultrasound machine as interferential therapy, and जब उसे पूछा कैसे करना है तो principal भी गायब था. This is the shortwave diathermy. This is microwave diathermy. These are the machines which we use. This is electromagnetic pulse generators which are going in the body, creating a field and just producing heat there. General indications and contraindications of heat therapy. Indications are subacute or chronic inflammatory conditions, reduction of subacute or chronic pain, subacute or chronic muscle spasm, decreased range of motion, hematoma resolution. Hematoma, chronic hematoma, not acute. Then reduction of joint contractures. We use it for joint contractures. I haven't used in osteoarthritis grade 3, where you are typically finding pes anserine bursitis. Then shortwave diathermy do wonders. And sometimes you have to go with the patient's approach. If he says this is too hot or this is too insignificant, then you have to take it out in that way. Sometimes irregular surfaces create more heat. For contraindications, acute injuries, open wounds, impaired circulation, peripheral vascular diseases, deep vein thrombosis, advanced arthritis, uh, poor thermal regulation, anesthetic areas, neoplasm. One question from my side is, if there is a neoplasm, say post modified mastectomy is there, person comes to you with a shoulder pain and you find out there are two or three trigger points, one in rhomboids, one in trapezius, and one in levator scapulae. Would you like to go for these kind of modalities, any modalities? Why? This is where you have to learn the question completely. I have already told, modified, they haven't completely resected. And the another portion which is not clear, साइड कौन सा था, राइट था कि लेफ्ट था. ठीक है, तो these are relative contraindications. And I have seen, if you use simply putting a moist towel, how that is going to increase the chances of improving mats or increasing the mats. He is going for a hot shower in the house also. So can you focus on this part and say no, this is contraindicated? So that is a relevant point to discuss. These are the various electrotherapy modalities. Transcutaneous electrical nerve stimulation basically works with, say, on nociceptive pain, acute, subacute, chronic pain, and neuropathic pains. Percutaneous electrical nerve stimulation. Percutaneous means you put a needle inside now. For transcutaneous electrical nerve stimulation, you have applied the electrodes and there will be low intensity current which overwhelm the pain carrying nerves, and with physical and this other vibration kind of sensation. So percutaneous, you go with, say, putting a electrode inside the area. Again, this is for the mild to moderate pain. This is also used post-operatively. Electrical twitch obtaining intramuscular stimulation. These are all till interferential current, TENS, percutaneous electrical nerve stimulation, electrical twitch obtaining intramuscular stimulation. These are different types of TENS where you apply from the skin or you go inside or go deeper. You find out ultrasound guided. This is the node where you put the electrode there. So those kind of things are there. Interferential current, two currents are there. You always go with, say, resonance effect in these kind of things. There will be high amplitude, there will be low amplitude, low intensity current will be produced, which clear out the local pain sensation. Electromyostimulation, these are used for, say, stimulating the muscles or increasing the strength. High voltage galvanic stimulation, again muscle strength is involved, or say some initial phase of, say, neurogenic shock is there to maintain the tone of the muscle. You use these kind of things. Microcurrents are used in depression, PTSD, anxiety, neuropathic pain, and fibromyalgia. Iontophoresis is a way of transdermal delivery of the medication primarily. This iontophoresis can be used again with, say, acute, subacute, chronic. Most of the times, all of these things are not being properly researched. So evidence, if you say, I don't know. But is it effective? With my experience, I have given you the data initially that in 40,000 cases, if you are giving this much of, say, therapy and they are happy with that, we are not going to jump on each and every case for a procedure. So with that thing, you can easily get the idea. Precautions, menstruation, area of nerve sensitivity. If you are going to give a IFT or TENS in lumbar area in this condition, then I will say you should not give. But somebody comes with, say, neck pain, you can go with it. Unfused epiphyseal plates. Usually we don't get such kind of patients in our routine OPD for pain. Severe obesity, effective ही नहीं होगा. इलेक्ट्रॉनिक मॉनिटरिंग एंड इक्विपमेंट लगा हुआ हो कुछ, या डीवीटी हो, तो ये ध्यान रखने वाली चीज़ें हैं. डीवीटी में फ्यू मोडालिटी, हीट शुड नॉट बी यूज्ड, cold should not be used, But for electrotherapy, I can slightly check the case and go with it. Contraindication again, cardiac disability, instability, demand type pacemakers, arterial disease, uncontrolled hemorrhage, site of infection, blood clots, pregnancy, cancerous lesions, exposed metal implants, history of seizures, sensory and mental impairments, unstable fractures. So these are there for contraindications. This is the newer modality which I have used for say more than 3 4 years. Very effective. Not used much in say shoulder, but for plantar fasciitis we have done very good. Uh, we use it in a weekly, thrice weekly way with a very low shock number of shocks. Here you see 2,000 to 3,000 shocks he is giving. We used to give only 150 to 200. Okay, so if it is written like this and you go for 2000, that becomes very big task. There are different types of ESWT. Normally 100 to 120 shocks with a pressure of say 25 bars, M bars will be more than sufficient in case. Sometimes we have seen the complications. There is a large bulky mass in trapezius. So for that we have to give the block, and ice pack was used post therapy sessions every time then. Indications, plantar fasciitis and rotator cuff calcified tendinopathies. Evidence is not there, experience is there. Bleeding disorders, pregnancy, we should not do it. And complications, as I said, ecchymosis, hematoma, soft tissue swelling, redness of skin, increased pain. These have to be explained to the patient before giving or prescribing this kind of. We can go with this approach. Either you go with myofascial pain release, myofascial release, MFR, or you go with say PNF techniques, or you can choose this one. तो देर आर ऑप्शंस. इट इज़ नॉट लाइक कि ऑप्शन ही नहीं है. और या आप जो परक्यूटेनियस इलेक्ट्रिकल नर्व स्टिमुलेशन देते हैं, यू फाइंड द ट्रिगर पॉइंट विद योर प्रोब, अल्ट्रासाउंड प्रोब, put the needle there, and you can continue. Low level laser therapy, 100 to 200 milliwatt is applied for short period of time with a wavelength of around say 1000 nanometer, 500 to 1000 nanometer. It reduces pain, multiple trigger points in the back area. Patient who is already on say many psychiatric medications looks dehydrated, appearance is exhausted. So in that case, if you hydrate the person, as Dr. Pandey already told, nutrition and hydration are very important. Correct the two things. Then protein is very important for muscular point of view. After correction, you have to look for, give a period of say around 4-5 days. You can use these kind of modalities at that time. Then plan for a procedure. Acute and chronic neck pain, joint pain, including wrist, fingers, knee, TM joint. Again, lateral epicondylitis. We use it on a larger area, not a smaller one. So along with this, one more important thing, RTMS. I missed it out, and this is the newer modality which we have working on, as RTMS can be used to alleviate fibromyalgia. So just a few days back, I am working with our psychiatry colleagues to plan out a procedure that how we are going to give. Most of the times they say कि therapy session should be for say around half an hour a day or 2 times a day for half an hour and for 21 days or more. And nobody has judged that the effect is persistent or not. So it's a gray area for research. So that completes my physical modalities.